Hi, I'm Sarah. Welcome to the Hospo Health Program. Of course, drinking and drug use is never free of risk, and it can result in harm to the person who drinks or uses drugs, and sometimes to those around them. In this video, we'll be looking at some of the signs and symptoms for recognising when your alcohol or drug use may have crept into a high-risk zone, and what you can do to help yourself if you recognise some of these signs and symptoms. Addiction is when there's an uncontrollable urge to consume a drug, whether that be alcohol, illicit drugs, prescription or over-the-counter medications, because of either physical or mental dependence on the chemical that's in the drug. Usually this is because the substance has a pleasurable or satisfying effect, or it helps us to stop feeling bad feelings, or even makes us feel like we're coping better, at least in the short term. Some drugs are more addictive than others, and while not all drugs are physically addictive, they can still be psychologically addictive, meaning that you're mentally dependent on them. Let's first look at some of the signs and symptoms of alcohol misuse. To reduce the risk of harm from alcohol-related disease or injury, including mental health concerns, Australian guidelines recommend that healthy men and women should consume no more than 4 standard drinks on any day, and no more than 10 standard drinks per week. Sometimes it can be hard to notice when a regular couple of drinks has turned into too many too often. Identifying that you have a drinking problem isn't always simple, but the fact that you're thinking about whether you have a problem is a good start. There are some common signs and symptoms that you can look out for. Some of the mental and social signs that you may notice within yourself include worrying about when you'll be able to have your next drink, drinking alcohol or wanting to as soon as you wake up, consuming alcohol regularly on your own or trying to hide your own drinking from those around you, worsening relationships with friends or family, always staying out late or staying back after a work shift and encouraging friends or co-workers to keep drinking even when they've said they want to go home. There are also some physical signs that might indicate that your alcohol use is at high risk levels. These include sweating when you don't drink alcohol, feeling nauseous when you don't drink, being unable to get to sleep without drinking alcohol, and needing to drink more and more alcohol to get drunk or to feel relaxed. Some useful questions to ask yourself about your drinking behaviour that might indicate if it has become a problem include: do you drink because you have problems or in order to feel relaxed or calm? Is your work suffering as a result of your drinking? Have you ever tried to stop drinking or to drink less and found that you can't? Do you drink in the morning or before or during work? Do you ever have loss of memory due to your drinking? And do you lie about how much you drink or how often you drink? Or perhaps other people have commented about your drinking and think it's a problem. Of course, there are many other drugs besides alcohol, including prescription and over-the-counter medications, that people can develop a problem or addiction with. And the signs and symptoms may look a little bit different from those related to alcohol misuse. If you're concerned that your drug use is problematic or might be developing into an addiction, there are some more common social and behavioural signs to look out for. For example, people struggling with a drug-related problem or addiction might start to avoid friends who don't take drugs or avoid places where it's not possible to take drugs. They may feel distressed and lonely if they don't take drugs regularly, or rely on drugs to cope with emotional problems, including work and interpersonal stresses. They might also be starting to be dishonest with friends and family to hide their drug use, might have financial problems and debts, and even start to sell things or steal things to pay for drugs. They may engage in dangerous risks such as driving under the influence of drugs or get into legal trouble. And they commonly experience feelings of self-blame and low self-esteem, especially after trying unsuccessfully to quit the drug. Drugs and alcohol can of course cause a range of problems for physical and mental health, even after the acute effects of the drug have worn off. These can include depression, anxiety, having unusual ideas, paranoia or delusions, hallucinations, attention problems, memory loss, weight loss and sexual dysfunction, just to name a few. If you are drinking heavily and or taking drugs regularly and recognise some of the signs or symptoms that we've covered in yourself, then it's important to talk to a doctor or a mental health professional, such as a drug counsellor or a psychologist, as soon as you can. Continuing to drink heavily or take drugs might seem like the only way to feel better, but it can lead to some pretty serious consequences, including ongoing mental and physical health issues, relationship issues, loss of your job, and financial stress. Further information, including how to access support, is included in the handout online.